Hi, this is Dr. Grace Chen. I'm a licensed marriage and family therapist and MGR approved consultant. In the past 2 years, I have facilitated 85 EMDR basic training consultation groups and over 50 EMDR certification groups. So I conducted a qualitative research using my own EMDR basic training consultation group notes and identified the 10 most frequently asked questions from my consultees. This short series of short videos are designed for the beginning EMDR learners who start out to incorporate EMDR into their clinical practice. And the next commonly asked question is related to getting the client's negative cognition. To answer this question, we first need to understand what constitutes a good negative cognition. A good negative cognition is an I statement in the present tense while the client holding the worst part of a memory in their mind to identify a self-perception about themselves. The goal of the phase 3 assessment is to activate the client's experiences from the target memory by identifying the negative cognition, emotional responses, and body sensations. Phase 3 assessment is often brief because the goal is to activate the experiences so we can move into the phase 4 reprocessing and put most of the time in the phase 4 reprocessing. Identify the negative cognition is an important part of the phase 3 assessment. A lot of times, clinicians found themselves struggling to help the client identify the right negative cognition and often ended up turning the phase 3 into a talk therapy session, and they are not able to ended up having time to move into the phase 4 desensitization. So we don't want to fall into the struggle to find the right negative cognition while trying to find the one that will help the client to activate their trauma experiences. As soon as it's good enough and they can activate the trauma experiences, that's good enough. So if a client struggle to find a negative cognition and might even ask then or now, then I will invite the client to hold the worst part of the memory or the imagery representing the worst part of the memory in their mind now. And instead of figuring out whether the negative cognition is how I believe in the past or now, we want them to think about the past events in the present moment. And also because a lot of times a single memory might have multiple segments connecting to different negative cognitions. So when we focusing intently on the absolutely worst part, it will help us specifically identify the negative cognition in that specific part. And then it eliminate a lot of confusion when thinking about different segments. When the client offers a statement like, I should have known better, we can also probe deeper by asking the client, but you didn't know better. So what does it say about you? Or if the client might say, it said about my caregiver, like my mom, my dad, my grandmother, or so and so. It said about my caregiver as a bad caregiver has nothing to say about me. I might say, yes, they are bad parents, bad caregiver, but how does it make you think about yourself to have a bad caregiver when you hold on the worst part of the memory? It is also acceptable to use a negative cognition cheat sheet that provided in your EMDR basic training menu. If a client just entirely stuck, not able to identify the negative cognition, usually what I try to do is that I will ask the client to hold the worst part of the memory or the imagery representing the worst part of memory in mind, and then ask them to notice what following statement that I just throw the client some of the negative cognition that might work with this memory, and then asking the client just to feel which following statement sounds right to you. And then sometimes none of them might be right, but close enough, but it will prompt the client to think about and activating what's the right negative cognition by throwing them some of the close ones.